Now, the next topic we are going to be speaking about today is autoimmune disease. Autoimmune disease in general is loss of self-tolerance. Now, self-reactive lymphocytes are all the time or frequently are being generated, but they undergo apoptosis. Now, classically, childbearing women are affected more when we are talking about autoimmune diseases. Environmental triggers and also genetical predisposition make these individuals susceptible to have an autoimmune disease. The first autoimmune disease, which we have addressed before this slide in hypersensitivity reactions, now we want to talk about more in detail, is systemic lupus erythematosus. This is a systemic autoimmune disease where antibodies are formed against multiple tissues. Now here, type 2 cytotoxic and type 3 antigen-antibody complex hypersensitivity reaction is involved. And the classic presentation of this is fever, weight loss, arthritis and arthralgia, skin mallow rash. I told you that butterfly rash is very common, especially when these patients are exposed to sun. Then we have Raynaud phenomenon. They have this photosensitivity which produce a maculopapular rash. They have this discoid rash, oral ulcers, and many other systemic presentation. Here you can see some of the pictures of these patients. Here you can see the mallow rash or butterfly rash on the face, also the photosensitivity of their skin. Now, less common symptoms are hematological, musculoskeletal, and serositis. Many presentation, in fact. But one of the most common cause of death in patients with SLE is kidney failure, which is commonly caused by diffuse proliferative glomerulonephritis. This is very important because these patients may form different sorts of kidney problem, but one of the most common causes of kidney failure in these patients is diffuse proliferative glomerulonephritis, which is a type of nephritic syndrome. Now also they may have these heart presentation like pericarditis, myocarditis, endocarditis. These patients' heart specimen, we can see Liebman-Sachs endocarditis, and this is vegetation on both sides of the tissue. Now also coronary disease can be involved, lung disease like interstitial lung disease, pulmonary hypertension, vascular vasculitis. They're also hypercoagulable, so they're very prone to form thromboembolism, and they may present with some neurological seizures, psychosis, and personality changes. This is characterized by ANA or anti-neutrophil antibodies, anti-double-strand DNA antibodies, which is more specific. Now, we also have drug-induced SLE, which is characterized by anti-histone antibodies. It's commonly caused by drugs such as hydralazine, prokinamide, and isoniazid.